last talk of the morning is by Wallace, I guess. Yeah, I'm still looking for it, but I know it's you. And so, navigating digital gaps and cultural dynamics to promote fairness and the likes. Okay, so this is the clicker.
Okay. So my name is Wallace Chigona. I'm from the University of Cape Town, as you've heard. So I'll be talking about digital gaps, cultural dynamics, and innovation. So I don't know whether to say unfortunately or fortunately. About it being like my talk has been covered by the minister in the morning. So I don't know whether just would go and take a seat. Okay, so what I'm going to talk about is based on the research which I've done with my students, and some of the works are listed here. So these are the PhD students. So all these are working on M-Health and on maternal health, and I'll come back to that point in a minute. So my topic for today is about cultural dynamics and inequalities. So I'm choosing to focus on maternal health because it's important. I mean, we have hit it in the morning. It's been a common example of M health. It's on the 3.1 on the SDGs. But again, since I'm focusing on cultural differences, maternal health, okay, so basically, our health-seeking behavior is affected by our cultural context. So whether I go to a doctor or not, on the background of my mind, that's linked to my cultural belief and my economic situation. And an extreme case of that is in maternal health. Right? So maternal health is affected by cultural beliefs. So I mean, women can choose to, okay, maybe there are rules on when do you tell someone that you're pregnant? Who do you talk to when you're pregnant? What do you eat? And all those kind of things. So these are all cultural issues which govern behavior in pregnancy. So when you're talking about healthcare and digital healthcare, I think the starting point is there is inequality globally just on healthcare itself, even before talking about digital. I mean, if you look at this graphic here, so same story, right? The so-called global north has got access to healthcare anyway. And the global south has got poor delivery on healthcare. I mean, if you look at sub-Saharan Africa, it's pathetic. If you look at maternal health specifically, right? So I mean, that's the maternal mortality rates. Right? So this is the number of women who die per day, or who die like during pregnancy. The minister talked about the figures for his country, but you look at, in general, the figures are worrying for sub-Saharan Africa. And most of these deaths are preventable. I mean, if I'd improved healthcare, if I'd improved information, we could improve some of these stories. So I mean, there's sort of an example of the cultural practices for pregnancy. So I'll skip that over. But fact is that all of these and more cultural factors affecting healthcare seeking behavior. So I guess we are now saying this is where we're supposed to deploy technology and solve these issues, right? M-Health for maternal health. So I mean, like on those studies, I think one was Jacaranda Health, which Jack mentioned. Another one was from Malawi on those PhD students. But the reality is, despite the hype we have about mobile phones, they're not that available. There are divides. If you look at this image here, the global north, the global south divide. Within the country, right, the urban and the rural. So people in the urban areas, people with money, have got phones. People in the rural areas don't have phones. More important to the topic here, gender divide. Men have got access to phones more than women have got access to phones. So when you're talking about deploying technology, To who? How? So I think we have to bear that in mind. I took this slide from someone else's paper, but I thought it was kind of relevant to what we're talking about here. So when we're talking about deploying technology, we're talking about digital divide. It's not a simple thing as only technology. There is more, right? So there is education. So I mean, even if we gave the women phones, as the minister was saying, are they able to read and write? Are they able to use the phones? So there are much more dimensions to the divide. So when we are thinking about the divide and how to address the divide and how to be just, I think we have to consider that there is more to this divide. So when you're talking about inclusive design, therefore, I'm suggesting that we have to think of more. Think of the health-seeking behavior in the country. Think of the cultural issues. Think of the usability and other things. So I thought of having 5 lessons. Why 5? Just a random number. Just thought 5 was sounding good. Thought 7 was a bit too much for the time, so 5. So I think one of the issues which came yesterday and today was about trust. Do people trust the systems? They don't automatically, right? So we have to work towards legitimizing the systems. People have to come to a point of trusting the systems. So, for example, I mean, in the case of Kenya, initially people thought, SMSs about this thing, maybe this is a scam. Maybe this is a Nigerian, some other guy trying to steal money from us, right? So you have to work towards legitimizing the system. One way they did this in Kenya, in the Jacaranda healthcare, for example, was by having a clear link between the intervention and the Minister of Health. So there were posters in the clinic. The nurses were talking about this system. So that improved in legitimizing the system. Take cultural context into account. So in many parts of Africa, I don't know the other parts of the world, women trust older women about pregnancy information. Older women are the custodian of the cultural values about pregnancy. So, in your design, if you leave out the older women from the ecosystem, you are bound to fail. People are bound to ignore the system. They'll go back to their grandmother for advice anyway. So I think I'll jump to the last part, one point due to time. You must use intermediaries. So intermediaries are people like information intermediaries. So people who have got the phones which other people could use. Maybe not maybe the husbands, maybe the chiefs, maybe other people in the village should be encouraged to share the phones with other people in the community. I think I'll talk about the other lessons next year's seminar. So thank you.